Good morning. I'm Camila, and tonight I will be demonstrating a IV administration of a mini bag. Um, the first thing I will always have to do is to check my patient's medical history, which I have right over here from the patient's MAR. So I have Mr. PNL, a 76 years old male with no known allergies, and our physician, Dr. Markham, has ordered a medication, pantoprazole, 40 milligram through IV every 6 hours. So the next thing I will do is to verify and make sure our MAR and the physician's order match. So what I will do is I will compare both of my order with my MAR. So I have Dr. Markham has ordered pantoprazole to Mr. PNL, and this medication is for my patient, Mr. PNL. The medication name is pantoprazole right there, 40 milligram via IV intravenous. And the time of administration will be 8 a.m. in the morning. So since I have already verified and compared my MAR with my physician's order, the next thing I will do is also to verify the medication to make sure I have the correct medication for the correct patient with the correct dose. So we will do that next. Before I do that, I will sanitize my hand. So I have my medication here. We have pantoprazole, 40 milligram every 6 hours via IV. And I also know that, and I will also check the expiry date, which seems fine on our medication. And the other thing I will also do is to verify the medication, to verify our mini IV, which is 50 ml. And I will check for the expiry date, which seems fine here. And I will also check for any discoloration of the packaging or the solution inside my mini IV, which seems good. So we did our first check. And the other thing I will do is during this time, I also have my label that I need to put on my mini IV once the medication is inserted inside. So I have filled up all the information. I have the patient's name, room number, name of the drug, which is 33 ml of pantoprazole. Amount is 3 ml, added by myself, KN. The solution base is 50 ml. Date is today's date, and then the time and flow rates according to our calculation, which I've already done. So we have our calculation here. We have our mini IV contains 50 ml, and the drop factor is 10 GTT per ml, and then this needs to be administered within 30 minutes. So we have 30 minutes, and our drop rate would be 17 GTT per minute. Since I've already compared all my medication with my order and my patient's MAR, now we are ready to insert the medication in our mini bag. So I will take my syringe I have 5 ml syringe, and I have my needle, 18 gauge. Once again, I will compare my medication with my MAR, which is 40 milligram of pantoprazole every 6 hours. And the time we need to infuse this medication is 8 a.m. Now I will go ahead and reconstitute. We will go ahead and take the medication in our syringe and add it into our mini IV bag. So I will take 3 ml of air, I have no bubbles, so actually I see one bubble. I have 3 ml of our medication. Since I haven't wiped, one thing I forgot to mention is because this vial was already used, what I needed to do is to take a alcohol pad and wipe, which I should have done it before, but I know that I'm supposed to do that. And then the next thing I will do is to wipe our mini bag where we're supposed to inject the medication. And I will dispose uh, my needle into my sharps container. And the next thing I would have to do is agitate my mini IV gently so we can mix up the medication. And now we know that medication is all clear. Now we can go ahead and place our label on the empty site. And once again, we will compare our medication with our MAR. So we have 3 ml pantoprazole, 3 ml, and our patient is Mr. PNL. Okay, so now we have already added our medication into our mini bag. So the next thing we will do is we will go to our patient's room with a few alcohol swabs and our port. So during this time, before I start the infusion, I will make sure that my medication is compatible with the primary infusion, and also I will assess my patient's IV site to see if there is any redness or any infiltration. So now we're ready to go to our patient's room. Okay, so the first thing I will do is, for my patient's privacy, I will close the curtain and I will make sure that my patient is comfortable, and I will meet my patient. Good morning, Mr. PNL. I'm Camila, your nurse. Dr. Markham has ordered pantoprazole medication for your stomach to reduce your acidity and make you feel better. Do you have any questions right now? No? Okay. Mr. PNL, can I please get you to verify your name and your date of birth? Perfect. Thank you. Do you have any pain right now, Mr. PNL? No? Okay, great. How about any allergies with medications? No? Perfect. So the next thing I will do is I will adjust my patient's bedding, make sure that he's comfortable, and it is a good environment for both of us to work together. So I will quickly do that. And I will also check the site of the IV, which I already did, and it seems good. So now we're ready. As you can see that I have already set up my primary line over here, and I've already placed the hook to make sure that my mini IV will be higher than the primary IV. And that is all set. I will sanitize my hand. For this assignment purpose, we are not directly handling our patients, so I will not wear my gloves. But normally, if I were to handle my patient directly, I will wear a clean gloves. So let's start by fixing our mini bag. So the first thing I will do is I will make sure that my clamp is all closed. Okay, it's already closed and good. So the next thing I will do is to connect my port with my mini IV. And before we attach our mini IV, I will make sure that I don't have any air. So what I will do is gently press and now we see that we have some medication. So what I will do is gently open the clamp. Now we can see our medication is gently dripping. And I do not see any air in my tube. So we are ready to go and attach our mini IV to the primary port. Okay, so the first thing I would do is clean the connection site of our mini bag with the primary IV. So I will Okay. So while I did that, I fully opened um, the port on our uh, mini IV or mini bag. So now I know that the medication is running uh, in our patient. So what I will do is I will also readjust our primary line to 17 drop per minute. And while that is happening, what I will do is observe my patient for any adverse reactions or any allergic reaction. And I also close the clamp once the medication is done. What I will do is I will close the clamp on our secondary set and then place the primary line directly on the IV and adjust it back to the drop rate it was before. And and I will also make sure that I speak with my patient, make sure my patient is comfortable and Mr. PNL has no pain at the moment. And I will do another pain check to see everything is fine and the patient is doing well. While everything is going well and everything is, my mini IV is disconnected after the 30 minutes, and the primary line is running back to the setting it was before. I will also document everything. My documentation will be uh, the administration of pantoprazole to Mr. PNL, um, and the volume was 30 ml of the medication via IV for 30 minutes. And while I clean up, I will also sanitize my hand before I leave my patient's room. Thank you for watching.